Fantastic. Right, we're going live. Okay, firstly, welcome to today's meeting of the Health and Wellbeing Board here in Committee Room 1 at County Hall. Before I start, I'm going to ask if we can do some introductions, because quite a lot of people here who won't know who other people are. So I'm going to start on this row and then move down the rows as we go. So I'm Councillor Barry Flux, and I'm the Chair of the Health and Wellbeing Board. This is my second meeting in the Chair. I'm also the Business Chair at the Council. Just one other point. We have these new mics in front of us. When you speak, if you press the button on your right-hand side, you'll see a red light come on, and that will help with our audio because we've got lots of noise outside. So I ought to have probably said that one first, shouldn't I? Once you finish speaking, if you can turn it off as well, that's useful as well. Thank you.
Good morning, everybody. I'm Kath McAvoy-Carr. I'm the Exec Director of Adults and Children's Services for Northumberland County Council.
Good morning, everyone. I'm Daljeet Lally, Chief Executive here at the Council.
Good morning, Paula Mead. I'm the Independent Chair of the Children's and Adult Safeguarding Board.
Good morning, everyone. I'm Suzanne Lamb, and I'm Head of Safeguarding and Head of Nursing with Harrogate and District Foundation Trust.
Good morning, my name's Liz Morgan. I'm the Director of Public Health in Northumberland County Council.
I'm Leslie Bennett from Democratic Services.
Good morning, I'm Maggie Bailey, Chief Executive of Coping with Cancer North East, and here representing the VCSE sector.
Good morning, everyone. David Thompson, Health Watch Northumberland.
Good morning, everyone. I'm Councillor Liz Simpson, New Biggin Central and East.
Hello, Glenn Sanderson, Leader of the Council.
Hi, everybody. I'm Lisa Long. I'm an Associate Director for CNTW and here on behalf of Pam Travers.
Good morning. I am Robin Hudson. I'm representing NHS Northumberland Clinical Commissioning Group. I'm Medical Director.
Good morning, everyone. My name is Wendy Patterson. I'm the County Councillor for the Long Houghton Ward, and I'm also the Cabinet Member for Adult Wellbeing.
Morning, Alistair Blair, Medical Director, Northumbria Healthcare.
Good morning, everybody. I'm Marion Dixon, the Executive Director of Nursing, Midwifery and EHPs at Northumbria Healthcare.
Morning, I'm Claire Riley, Executive Director of Communications and Corporate Affairs for Northumbria Healthcare.
I'm Richard Dodd, County Councillor.
I'm Veronica Jones, County Councillor.
Anne Bridges, Head of Comms at the County Council.
Okay, thank you for that. I know it's a bit funny having to do that, but it's useful for us. Part one, apologies for absence. Do we have any apologies for absence?
Yes, Chair. We have apologies from Siobhan Brown, Jane Lothian, Rick O'Farrell, Councillor Renna Thompson, Graham Sayers, Pam Travers, Jeff Watson.
Thank you for that. Disclosures of members' interests do any council members have any interest to declare? I can't see any at all. So we go to the substantial part of the agenda, items for discussion. Point 3, report of the Executive Director of Adult Social Care and Children's Services, change to the partnerships between the County Council and NHS bodies to inform the Board of the dissolution of the partnership agreement between County Council and Northumbria Health Care NHS Foundation Trust and the proposed new partnership of the Council and Harrogate and District NHS Foundation Trust covering the public health service for children, young people and families which were included in the partnership with the Northumbria Healthcare Foundation Trust. I'll pass over to Kath McAvoy-Carr.
Thank you very much, Chair. This will be a two-part presentation, so I'll do a little bit of a presentation around the adult social care arrangements, and then I'll pass over to Liz, who will do a bit of a presentation around the 0 to 19 proposed arrangements moving forward. Rather than going through the report, which I'm assuming that everybody's had an opportunity to read, we thought it would be useful just to pull all of the information together as part of a presentation. Oh, I nearly pressed the wrong button there. I have pressed the wrong button. Oh, okay, sorry. So this is really just a little bit of a potted history in relation to how we've got to where we are in the last few years or so. For some of you, you may remember that in 2001 the Northumberland Care Trust was set up, which helped to deliver adult social care and community health services, which was the start really of promoting significant integration between health and local authorities. In 2009, the NHS Transforming Community Services set out to improve primary and community care, which separated the NHS providers and the commissioning arrangements. And as a result of that, we in this area established the end of the Care Trust. And in 2011, Northumbria Healthcare Foundation Trust and the local authority entered into what we now know as the partnership agreement, which involved Northumbria Healthcare Trust taking the statutory responsibilities for the delivery of the adult social care functions. And then in 2013, Public Health Services transferred from the National Health Service to the local authority in terms of commissioning. And as a result of that, Northumberland County Council took over the contracts from Northumbria for the provision of the 0 to 19 sexual health and other public health services. And then in 2018, that then became part of the current partnership agreement as we know it. So in terms of the current situations and how we've got to where we are today, the original partnership agreement was subject to regular reviews, and usually that involved the rolling on of the partnership arrangement for a further year or for a further 2 years or 3 years, depending on what the situation allowed for at that particular point in time. There was a planned review for 2019 and 2020, and I think it's probably fair to say that there were some challenges with that review. The pandemic hit us and we weren't able to meet in the way that we had previously met. There were some issues that arose as a result of the pandemic that led to some differing views of the two organisations. There were some HR issues and some issues around terms and conditions that needed to be addressed, and there were some issues raised around governance and delegated functions and how those were going to work. In July 2020, as part of that review, a presentation was given to the Northumbria Board in relation to what we called the CAST model, Northumberland Care Services Together. But unfortunately, an agreement couldn't be reached between the two organisations about how that might work. In early 2021, I'm sure most of you will be aware that the white paper Integration and Innovation Working Together to Improve Health and Social Care for All was published, which talked about the need for integration. But then by the end of February, or as part of February, discussion about the extension of the partnership took place around extending that until April 22 as a result of some of the conversations that we'd not been able to resolve over the previous year. And then, unfortunately, in February 2021, notice was served in relation to the termination of the partnership by the Trust, but an agreed extension until September 2021, which is how we've got to where we are today. So in terms of what this covered, we just thought it would be useful to go through where we are at in terms of the developments and the plans that we've made in relation to the transfer or to the dissolution of the partnership. Adult social care, as I'm sure most of you are aware, is the biggest area of transfer. It involves 600 plus staff transferring back to the council. It covers things like case management, social workers who are involved in complex cases and complex care management processes, our strategic safeguarding arrangements. It covers our approved mental health team, our emergency duty team. We have something called a risk and independence team, which looks at care packages to make sure that they are providing value for money and quality in terms of the care packages that are being provided. It covers self-directed support, direct payments and personal budgets. It also includes our Northumberland One Call, which is our one-stop, one point of contact customer services offer. So in relation to where we are with adult social care, we have gone through a TUPE process. We've gone through a process to look at understanding who needs to TUPE. We've notified all of the staff about who is TUPEing back to the council, and following that, we've developed what we're calling a new model of care and support. And that new model, in some respects, is looking to be more closely aligned to our primary care networks and also to our mental health services. There will be closer links to children's services and some of our other council and external services to help develop and connect to a much more whole family approach. There will be closer links with what I'm sure all of you know as our Northumberland Communities Together and also the community and voluntary sector, so that we can offer a greater choice of interventions at different stages and different phases of people's journeys in relation to care management. Sorry, I'm just going to take my badge off because it's catching on the table. So in terms of that, the principles around that are, I'm sure none of you will be surprised to read, ensuring residents have some control over the way that their care and support is provided as much as we possibly can. Making sure that family and our unpaid carers are treated as a core element in the residents' plan, and we consider their needs as well as those of the residents. We recognise or we look at the trade-offs between minimising risks around somebody's disabilities or presenting needs and their health conditions, and we support that person to help live the life that they choose. We are talking about a person's own choices should determine how those needs are balanced, so we can help to get that balance correct, ensure coordination between the services and understand all of the agencies involved, and support people to make the most of the opportunities available in the wider community, which is where the voluntary and community sector comes in and the Northumberland Communities Together. So what else does this include? It includes our hospital discharge and reablement services, and this service looks at the safe discharge and the appropriately timed discharge of our residents from hospital. It's about reablement to help people and our residents live independently and recover that independence should they have had an illness that has impacted on their ability to be able to live independently. That includes our home safe teams, our short-term support services, occupational therapists, physiotherapists, etc. So once again, we've been through an exercise to identify those staff who would remain with the council and those who would TUPE to the council and those who would remain with the trust, and those staff have been notified accordingly, and we're in the process of following that TUPE process. But we have developed something that we've called, or we're in the process of developing something called the reset model. And we love a little acronym, and this is where the acronym comes from. So reset is around recovery. So what short-term interventions can we provide following an illness, injury, or a discharge from hospital? So what additional interventions do our residents need in the short term to help manage in their own environments? How can we support our residents to learn or to relearn skills to carry out the usual or their normal daily tasks, and help with their reintegration or their social reintegration? Enable is really about allowing our residents to do things for themselves, so that they're doing with and not for, and which is helping to encourage independence and social integration as well. And we will have a dedicated team which will include occupational therapists, social workers and reablement support staff to be able to deliver that. This is just a little model to show how that will work. So there will be a number of routes into the reset services, from hospital discharge, community, where somebody in the community may recognise that somebody needs additional support, or self-referral via our one-call service. And then that just shows the potential outcomes from that, which might be around reablement care support, or may need something more detailed around an assessment or potential intervention, or actually may need something around our voluntary and community sector and via our Northumberland Communities Together offer. In terms of the other services that are involved in this process, we have our continuing healthcare service, which is currently funded by the Northumberland CCG, and there will be interim arrangements which will be maintained, which will be retained in order to help with integration, and the continuing healthcare process will be looked at as in terms of a transfer to the ICS when that comes into existence. Our learning disability community nurses, they are again funded by Northumberland CCG, and there is a planned review to look at how we manage that service go forward, looking at how the Trust and CNTW can be involved in that moving forward, and that review is currently ongoing to look at that area. The Joint Equipment and Loan Service, the GEL services as it is known. This service provides disability equipment and minor adaptations to both children and to adults who've got additional needs, jointly funded by the Council and the CCG again, and there is a planned transfer back to Northumberland County Council, although we will still continue to offer that integrated service provision. And this really was just an opportunity to highlight some of the future opportunities that this process will bring to us. I've already talked about the closer integration with the primary care networks and the multidisciplinary team working that will enable. We are looking at some work with CNTW around the co-location of social workers with specialist services and how that might work moving forward. Looking at the discharge to assess process and looking at how we provide more intensive rehabilitation in our residents' homes. Joint working with community health teams to support those in crisis and actually help to try and prevent somebody needing to go into hospital, as well as helping with their smooth discharge from hospital. More integrated support into our care homes, improving the connections for people who've got additional needs with our community and voluntary sector and our community resources. Another fairly interesting area is about how we support people who have what we describe here as chaotic lives, where they might have alcohol or substance misuse issues, and how we encourage and facilitate their involvement with some of our community support services moving forward. We're also looking at, and have been for a little while, a wider range of accommodation options and support that can be provided around things like Homes for Life and extra care schemes within the county. Looking at joint working with our housing and our property services to encourage and facilitate the independent living of our older people, and also how we can improve joint arrangements with CNTW around following discharge from hospital, and those conversations have commenced at this point in time. So I'm going to hand you over to Liz to talk about the public health services. Oh, I'll move that there. Sorry, Liz. There you go.
Thank you. So there are actually two public health services that were part of the partnership agreement that we needed to find alternative delivery options for. The first is the Integrated Wellbeing Service. And the Integrated Wellbeing Service is a team of about 30 or so health trainers, specialist improvement practitioners and specialist stop smoking advisors who work across the county supporting individuals, groups and communities. They also have a capacity building function, so they run the Better Health at Work Award for us, which is an evidence-based health improvement programme orientated towards employers. They provide training around a variety of mental health issues, support Making Every Contact Count and deliver Making Every Contact Count training to a whole range of stakeholders and partners. And they also support communities through taking an asset-based approach to improving health. So those staff will 2P into the local authority to work closely with us as a public health team, and actually they're already located about 30 yards down the corridor from us. So, you know, we already had a very close working relationship with them. And then the second service is the 0 to 19 public health service. So this is based on the National Evidence-Based Healthy Child Programme. That's a universal programme aimed at all children and young people up to the age of 19, but for those with a special educational need, a disability or other vulnerability, that service extends to young people up to the age of 25. So we had a number of options, but we really wanted to continue to provide this service through a partnership approach using a Section 75 partnership agreement. And the reason why we wanted to do that was because we believe that that provides us with much greater flexibility in terms of how we deliver those services. It enables integration and it promotes an approach which is based on shared objectives and joint solutions. So when we were looking around for a partner, we focused in really on Harrogate and District NHS Foundation Trust, and the reason for that was because they were already a very experienced 0 to 19 provider in the North East and in other areas. So they provide this service to 6 other local authorities in the North East, some of which have areas of rurality which are very similar to ours. And they're also commissioned actually by NHS England to provide the schools immunisation programme in the Tees area and in other areas of the North East. So we think with that experience that will provide us with a really good opportunity to explore and exploit the opportunities for greater integration with the whole range of children's services that we provide as a council, and a great opportunity to transform and innovate based on all of the experience that they've currently got. So at the moment we're just coming towards the end of a joint consultation on entering into a partnership agreement that will conclude on Sunday. So I'd just like to finish actually by passing over to Suzanne Lamb, who's the head of safeguarding in Harrogate Trust, just to talk about the trust and its approach to this particular service.
Thank you and morning. Yeah.
Sorry,
No, it's fine. We do already provide services in 7 local authority areas, which include North Yorkshire, Middlesbrough, Stockton, Darlington, County Durham, Sunderland and Gateshead. Those are our 0 to 19 services and immunisation services in a lot of those areas. Harrogate and District Foundation Trust's headquarters are in the Harrogate Hospital, but the 0 to 19 services are run out of our Community and Children's Directorate, and that Children and Communities Directorate is led by a triumvirate, and I'm the Head of Nursing and Head of Safeguarding within that directorate. I'm from the North East, I'm based in the North East, I live in the North East, right? And I know that that is something that people often hear, that they think Harrogate and District is going to be an area where everything happens from Harrogate. That isn't the case. My office is actually in County Hall in Durham. So Harrogate, we have a number of bases. The nearest bases to here at the moment are actually in Sunderland and in Gateshead, but we do have bases all over the North East, and we will be looking to develop further bases in Northumberland if this comes to pass. So a little bit about us. Our focus really is, if this partnership comes to pass, is about another assumption that is made is that it's one model, that Harrogate have a model and that is the model that is put onto everyone. That is not the case. It's one team. We have one team, but we don't have one model. The model would be developed in collaboration with the staff, with service users and with key partners, and that includes the incumbent healthcare provider. So we really do focus on listening to what works well, learning from what works well, but where we can bring something new is because we provide services in 7 other areas, we've really been able to drive innovation and through collaboration, particularly around developing a one-team approach with partners to develop integrated pathways. And that's something that we would look forward to working with partners on. So when we've had a lot of queries and a lot of worries, some of which have been around, will people be required to travel to Harrogate? No, they absolutely won't. I must say I do have to go to Harrogate now and again, but we wouldn't expect that of our staff. That's not what we would be expecting of them. They will be in the bases that they're in, and we very much hope that that will continue until we can find a suitable alternative, but only if that fits the needs of the service. We will be looking at really developing a new service model with the staff and with the service users. So we also bring a very strong thematic lead approach. So all of our managers are not only operational managers, but they take a lead on an area of service development. And that, where we really benefit from that is we bring all those staff together, all those managers together in something called a learning and best practice forum, where we share innovative practice, we learn from what's worked well, and we're really hopeful that we can bring some of that into Northumberland so that we can share that learning and people can benefit from some of those new innovative practices. There's a real focus on quality. We are aware that this service delivers a very high quality in terms of the delivery on the Healthy Child programme. We're not looking to change that, but there are things that we would look to change, such as we will develop an integrated approach in relation to safeguarding. So our management teams, for example, the named nurse for safeguarding, the specialist nurses for child protection, they are part of our integrated management teams. And that just ensures that we look at safeguarding as a continuum, and we absolutely ensure that integrated approach right at a strategic level. And that is in fact my role. I'm a head of safeguarding for the Trust, but I'm also the head of nursing for this directorate. We've got a really strong focus on values and behaviours. Every member of our staff has a monthly quality and performance management, which includes a wellbeing conversation. So it's a real strong focus on looking after our staff and ensuring their health and well-being. We've got a lot to learn from you as well, and every new service that we bring on and comes into Harrogate, there are things that we learn from them as well as things that they can learn from us. So we really, if this comes to pass, we're really looking forward to working together, developing best practice and building on what's working really well. I'm really here to answer any questions that anybody has about Harrogate, and that's my role today, and I'll be happy to take those.
Okay, that's the presentation there. So I move over to members of the board and whether they've got any questions to ask or comments to make. Yes, sorry, yes.
Hi, I just really want to make a comment as chair of the Safeguarding Partnership. We have invited Harrogate to our next Safeguarding Partnership meeting so we can scrutinise and discuss, the arrangements with them. I think I also want to say Northumberland actually has a very strong Safeguarding Partnership. All of the agencies are very committed. We've been inspected externally and also sort of look at ourselves quite critically, and we come off pretty well, I think, in terms of safeguarding. And I just want to say I really do like, if I'm allowed to make a comment as well, the plans for integration in terms of working more closely with children with the local authority. There's a long history and culture of working very closely in that way. In my past life, I was in the NHS and the head of child health in the community, and we were managed through a partnership agreement by Children's Services at that time, and it was a really successful model which was mentioned nationally as a model of good practice. That changed due to sort of reorganisation and so forth in 2011. So if people think safeguarding is all about child protection, and it isn't. Safeguarding is a continuum, and early years, early intervention, early help is a really important part of that whole system. And the health visiting service and the school nursing service in particular are absolutely key with that, and working with their early years colleagues in children's centres and so forth and schools is absolutely fundamental to safeguard children in the county. So I mean, I've answered I've given those views in the consultation, and so if the new model involves that, then that feels very positive. As has already been said, it is a high performing service. It meets its requirements within the Healthy Child programme very, very well. And I know that the partnership, that includes Northumbria Healthcare Trust, are strong members of that partnership. We will make sure it works, and it will work. So I just wanted to say that. Thank you.
Thank you very much. Has anyone got anything to respond directly to that, or shall I? I can see Councillor Dodd has his hand up. Councillor Dodd, I'm quite happy to allow yourself or Councillor Jones, given your past position, you as former chair here and Councillor Jones as a former executive member, if you wish to address or say anything, I'm quite happy to allow that.
Well, I would like to welcome Harrogate. Basically, Councillor Jones and I are here to listen to what people have had to say. There is an exchange of letters in this agenda that are quite, not quite the way they should be. Now then, if I go back, Councillor Jones and I had to virtually beg Northumbria Healthcare Trust to reconsider. And now they're back. I mean, there must be a million reasons why they're back, wanting this contract. It's probably not the right forum, but I want to get to the bottom. And it's probably not the right day, but I'm going to get to the bottom of what's going on here. Thank you.
Noted, Councillor Dodd. Does anyone else have any comments or questions to raise? Councillor Jones?
Yes, I really just want to go along with Councillor Dodd as Councillor Dodd as chair of the Health and Wellbeing Board and myself as the portfolio holder for adult wellbeing. I think what I'm saying is I just want to understand why the Northumbria Health Trust have now decided they would like to take part in this, and again with Councillor Dodd, the exchange of letters don't sort of tally with my recollection in various parts. I'm just trying to understand the reasoning when back in February, Councillor Dodd and myself did meet with the chair and chief exec of the Northumbria Health Trust, and I say I'm not sure, say beg, but we came very close to saying, please explain to us why, tell us what we can do, is there anything we can do to change it, will you extend it, can we continue the working party to see where we can go from here. And, you know, they were adamant that the partnership was ended and they did not wish to continue it. So I'm just puzzled as to why that's come back now. And like Councillor Dodd, I'd like to say, yes, we'd welcome Harrogate, and I do hope this goes through. Thank you.
Thank you, Councillor Jones. Does anyone else have any comments? Claire?
Thank you, Chair. Just to respond to that, we can't comment on a meeting that obviously we weren't at, and so we won't do that. That's for other people to comment. I think the letters have positioned where Northumbria Healthcare are, and in good faith, our chairman came to answer some questions at a corporate meeting on Monday. Following that meeting, there was a letter shared around us willing to pause and reflect and really sit back around the table. I know that we have a meeting at lunchtime to do exactly that. But I think realistically we have to look to move forward. It is almost it doesn't serve anybody any purpose. Our strength in over many years has been our collective partnership, and we shouldn't lose sight of that.
Thank you. Just to try to put the view forward from the patient perspective, you know, there is obviously some some history to this. We've heard the comments, we've read the letters and so on. And I've been just a little bit concerned that integration is the key, service to patients is the key. And if conversations continue in the manner which have been just suggested, that might, I fear it might, but I hope it won't, it might interfere with the process of getting the organisations to continue to work together in the interest of patients. So I would just suggest to everyone, put patients first and look to the future and make this revised system work. There may be reasons why it's arrived at this. I'm not particularly interested, but let's look to the future and let's get this sorted, because time is running out, and patients' care, health, well-being, safety must be the priority and must not in any way be deflected by raking over an old ground, however people think that might be justified. Put patients first and look to the future and get this sorted.
Thank you for that. Yes, Dalji.
Thank you, Chair. I must say I totally agree with David there. For us as a council, our absolute priority in these arrangements are our residents, who are our patients, and also our staff, irrespective of if they're NHS staff or they're council staff. The important thing for us is happy staff mean happy services and good quality care. So, I don't want to look back either. We're at a position where we are very near now to enacting the arrangements. Yes, earlier in the year and last year, we very much wanted the arrangements to continue, but we've done a lot of work, and as Kath and Liz have presented, we are, one of the things for us over the last 2 years has been about our integrated model of care and really pushing that out through the communities, so that people in our communities who aren't in bed-based services, who sometimes are very hidden in communities and are isolated and vulnerable, they're the ones that we focus in on and support and try to ensure that they have, whether it's the best start in life, the best progress as young people and adults, and unfortunately at the end of life to support them through. So these services that, nobody's saying people won't work together, that, our priority is our statutory functions. Our members, particularly our cabinet, quite rightly are very concerned. They know what our statutory duties are in relation to protection and overseeing vulnerability, child protection, adult safeguarding, but also supporting communities. So I totally agree with David. We put residents, patients and our staff first, irrespective of whether they're NHS or council. Look to the future. I am obviously responsible for all of our staff, head of paid service, that's my role. And in that role, I then am responsible for our residents in the community. I do believe Harrogate are a very strong partner. They've evidenced, particularly to Liz Morgan and to Kath here and McAvoy Carr, in terms of the responsible statutory directors. We haven't taken these decisions to look for alternative partners. As you may be aware, in some areas, the other part of Northumbria Healthcare's area, which is North Tyneside, those very services returned to the council a couple of years ago. We've taken a different approach because we see, that's a good approach too, but we see different benefits for us in terms of working with a new trust. One that can demonstrate a track record of delivering these services and delivering innovation in the community. So that's a bit of a long-winded agreement with David, but I absolutely agree. Let's look forward. Let's take these arrangements forward and innovate and continue to provide these excellent services in the community. Thank you.
Thank you. I perhaps should lay out my role in this, which is to lead the administration to ensure that all the decisions we make are sensible, sound and safe. and that we work with a whole range of partners across a whole range of services effectively and well and in harmony. Therefore, it's fair to say that this particular situation has been quite difficult to follow in terms of the process. And I made it clear in my response to the Trust chairman who wrote to me at the end of last week or beginning of this week, basically saying that he thought a pause in the negotiations would be sensible. And I have said to him, and I'll repeat it again here, that quite a lot of water has gone under the bridge since this first raised its head. I'm not prepared to waste any more time, as wasting time would be if we started a whole range of negotiations again. I am prepared, along with our officers, to meet up with the Trust just to see and to talk what has changed so significantly that would make this decision now in question. So we need to have that discussion. I'm more than happy to do that fairly soon. But throughout the period of receiving notice and today, I have asked and have received from Kath McAvoy-Carr a weekly update that outlines where we are, particularly in relationship to our residents and clients and patients, to our staff, who are exceptionally important in all of this and feeling very unsettled about where we are in this, and obviously also around the question of the financial implications, because we need to think about those as well. So I think it's really important for me to say, reasonably plainly, that the political direction is quite clear. We want to get this resolved quickly. We want to make sure our patients are looked after properly and quickly and safely. And we want to make sure our staff know where we're going with this once and for all.
Thank you, Chair. I really just want to echo what's been said by the leader, and also just to say that as the Cabinet member with a responsibility for our residents of Northumberland, I just want to ensure that we do the very best for them and also for our staff. I mean, that is vitally important, and that is a question I wanted to ask, and I must apologise to the lady from Harrogate. Is your name Sue? Because Suzanne, right. Suzanne, I liked what you said about meeting with the staff on a monthly basis. Do you meet individually with them, or do you meet in a group?
So there would be, as part of our governance, there would be quality of care business meetings, which are with the whole staff locality. But every member of staff is met individually once a month by their line manager for quality performance management and for a wellbeing conversation.
Thank you. I do think that's really important. Staff morale is everything. Thank you for that.
Okay, does anyone else have anything they wish to say? Yes, Claire.
I think just finally from us, I don't think anybody's questioning the quality of the service that has gone before it, and I think everybody would agree that staff have worked really, really hard, especially during the pandemic, but also during these difficult circumstances as we have managed or working through a transition. And I think it's important that regardless what happens, we need to thank staff for their work and dedication.
Anyone else wish to say anything? Well, I'll just finish by saying, of course, it's really important. It's been put through the questions and debate. The patients and the staff are of the key importance here, and whatever happens over the next few weeks, I think that's of critical importance. And I thank everyone who's made their comments today, and I'm sure we'll be back in the future discussing issues, whatever way it goes next on the 25th, or what have we. So without further ado, I'll close that agenda item and I'll go to the next item on the agenda, which is urgent business. I have no other urgent business, and it's just the date of the next meeting is Thursday the 9th of September 2021 at 10 a.m. in County Hall, quite possibly in this room, although if you've come in here, you've seen its building work, it may also be in a different room. We're hostages to fortune on that at the moment. So With that, I'll end the meeting and thank you everyone for attending and thank you all for contributing. Thank you very much. And I'll end the broadcast.